Hey everybody, so good to see you guys. So good to see you guys. How are y'all doing tonight? Thank you guys so much for being in here. Thank you guys. Means so much to me. Happy Tuesday, everybody. Is it Tuesday? Yeah. I got my days confused, guys. I was thinking it was Wednesday all day. But happy Tuesday, everybody. Woo woot. Let me go in and say hello to everybody. Thank you guys so much for being in here. It means a lot to me. Sorry I had to run a few minutes late because I had to give the youngins a bath. They wanted to be rambunctious and not go to sleep, and they're still partially awake. So sorry about that. I'm sure y'all know how it is, but let me say my hellos to everybody. Hello, Tammy Crimes. Good to see you, love. Hope you're doing well. Hello, Britt. Good to see you. Hope you're doing good. Hello, Gone Girl. Good to see you. Good to talk to you today, darling. Hello, Hindsight 2020. Good to see you, sweetie. Hope you're doing well. Hello, Evie. Good to see you, hon. Hope you're doing well. Hello, Hippie Grandma. Good to see you, honey. Hope you're doing good. Yes, Gone Girl said, hit the like, please sub up too. Thank you, Gone Girl, honey. Virtual hugs to you too, Gone Girl. Love you. Hello, Justice Jane. Good to see you, love. I sent those pictures to you. I don't know if you got them or not, but I did send them pictures to you, honey. Hello, Steffi. Good to see you. Hope you're doing well, darling. Oh, do we really, Gone Girl? I love that. That band is amazing. Citizen Soldier. If y'all have never heard of them, Citizen Soldier. They're amazing. I love them. Hello, Pac-Man. Good to see you, brother. Hope you're doing well. Okay, I'll check them, Gone Girl, honey, when I get off here. I'll check them, sweetie. Thank you for sending them to me, honey. Thank you. Well, you're welcome, Brittany Holt. Or Britt Holt. Sorry. Hope everybody's doing good. Thank you guys so much for being in here. Okay, tonight is a mental health topic. I told you guys, see my mental health shirt? Mental health awareness. I told you guys I was going to get back into topics, but we're going to talk about understanding bipolar disorder. Like how, like what's the importance, and, like if you have it, like how do you deal with it? Let's see, because I personally don't have it. Not that I know of. They haven't diagnosed me. No, not that I know of, but I'm just saying I support everybody. So we're going to talk about tonight, like what is bipolar, like what is the effects of bipolar. We're going to talk about what it entails, what it doesn't entail. I know it's a form of depression, like manic depressive disorder, something like that, but it's a lot of mood swings. So we're going to go over that tonight, and then like I said, I've been telling you guys for the past couple days, if I do cover anything mental health, it might be triggering. It might be. I'm not saying it's going to be, but it might be. So I'm just preparing you guys just in case. It shouldn't be, because I try to come across information that's not triggering. And if it is, I apologize firsthand. I try to cover information that is not triggering to nobody. So, but if it is, I apologize. But after I go over all the information about what it is, like understanding bipolar disorder, then we're going to go over like the positivity of having bipolar disorder, like how you can still function with it and live your life and be yourself. That makes sense. So we're gonna go over it, but we're gonna have the positivity of it as well. So I mean, like it's it could be triggering. Like I said, I'm hoping not, because I really do some massive homework and I go over it, and I'm praying that it's not triggering for nobody. It's just bringing awareness and support, because not a whole lot of people understand exactly what it means. They know it's mood swings and it's a form of mental health or mental illness, but they don't know exactly what it entails. So I'm going to start doing that more often. I don't know, how much, but I know, y'all, as you guys know, my channel is about support and awareness. So I want to throw that in there as well. with what like different mental health and mental illness like disorders, to see, kind of bring awareness to them and let people know that they're not alone. And if by chance they suffer with any of them disorders or any of, the side effects or anything that I talk about, please get help. Do not throw it under the rug, so to speak, because your life matters and you are very important. And there are people that care about you and they love you and they want to see you get better. They might not tell you. And I'm not saying, it's a bad thing, because I suffer with mental health myself, but everybody suffers differently, and like I said, I haven't been diagnosed as of, not that I know of, with bipolar, but I'm sure it is a rough road. So I just want to let people know I'm here for you guys, and I support y'all. And, I love each and every one of you guys, even the new people that are coming in here. I'm here for you guys too. If y'all need somebody to talk to, I'm not a counselor. I'm not a doctor. I'm nothing like that. I'm just here as a friend to give advice and be there for you, because some people don't have nobody to talk to. And I just want to let you guys know that I'm here for each and every one of you guys. And, I'm just saying, I might not understand what you're going through, but I can at least give you advice and, lift your spirits and say, hey, you really need to go to the doctor. You really need to, see about talking to a counselor or something to that effect. So that's what the support and awareness is towards the mental health that I'm covering. I cover like what it entails, and like then we cover kind of the support aspect. And then if you have it, or somebody that does have it, kind of like the positive side effect or the positive aspects of having it, if that makes any sense. Hello, Demetrius. Good to see you, honey. Hope you're doing well. All right. So let me pull up my screen, guys. And it says, you are not alone. Nobody's alone. Like everybody suffers their own way. And I just want to let people know, that y'all are not alone. Everybody, and there's a good majority of the world that suffers with some kind of mental health. They might not necessarily suffer with bipolar disorder, but they can still be there for you and lift up your spirits, and you can lift up theirs, and you can just be there for one another. It doesn't hurt to have a support system. It's very important to have somebody to just talk to, so it's not eating you up inside, or it's, you don't know what to do with your life. Like you matter. You're very important. And the people that there's people that love you and care about you, and your life matters. So please get the help that you need. You matter, and you're not alone. I'm just telling you that, guys, right now. It's very important. Please get help if you guys need it, please. All right, so let's pull up the information. Thank you guys so much for being in here. Please hit that like if y'all haven't, and hit the subscribe if y'all haven't done so. Thank you guys so much for being in here. All right, let's see. I can't believe it's already June the 20th. Lord have mercy. June 20th. That's crazy. Where in the world is the year going? Phew, out the window, I guess. It's going by quick, guys. Before we know it, blink and be Christmas time. Whew. I ain't ready for Santa Claus to come yet. Oh, Lord have mercy. All righty, guys. All right, so let's present the screen. All right. And I was asked, and I want to say by who, but I was asked to go over this. And if y'all have any topics, like I said, if y'all are curious about anything, I want you to get you guys involved as well. So if y'all want any information, or you want me to talk about anything specific or anything, this might be my channel, but I couldn't do this without you guys. So if y'all want me to talk about anything, send me an email, Facebook message, throw it in here, and I'll write it down. And I'm not saying when I'll talk about it, but eventually I will talk about it. But somebody, I won't say who, asked me to talk about this topic, and they've been asking, they've asked me for a little bit. So I figured it'd be a great mental health support and awareness thing to talk about. Hey, Truth Seeker, good to see you, love. Hope you're doing well, sweetheart. All right, guys. I see you, darling. All right, this is bipolar disorder, guys, and I think there is several different disorders. I'm not 100% sure, but we're getting ready to find out. All right, overview. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania, or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric. Europhic. Like I said, some of these words I might not pronounce correctly. Hello, small town girl, Miss Julie. How you doing, darling? I hope you're doing well, honey. Well, this is a lot of useful information, and maybe you might be able to, I guess, better understand it and be able to kind of help her with it without saying it, if that makes any sense. Just kind of help her along without talking about it, if that makes any sense to you, Miss Julie. All right. It says full of energy or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, which is psychotherapy. This is the symptoms, guys. There are several types of bipolar and related disorders. They may include mania or hypomania and depression. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. There is different bipolars, like I thought so, guys. Bipolar 1 disorder, you have at least one manic episode that may be preceded or followed by manic, or major depressive episodes. In some cases, mania may trigger a break from reality, psychosis. Bipolar 2 disorder, you've had at least one major depressive episode and at least one hypomaniac episode, but you've never had a manic episode. I'm probably not going to pronounce this correctly, guys, but I will try my very best. Cyclothymic disorder. You've had at least 2 years or 1 year in children and teenagers, and many periods of hypomania symptoms and periods of depressive symptoms, though less severe than major depression. Other types, these include, for example, bipolar and related disorders included by certain drugs or alcohol or due to a medical condition such as Cushing's disease, multiple sclerosis, MS, or a stroke. Hello, Wild Angel. Good to see you, honey. Hope you're doing well, sweetheart. Bipolar 2 disorder is not a milder form of bipolar 1 disorder, but a separate diagnosis. While the manic episodes of bipolar 1 disorder can be severe and dangerous, individuals with bipolar 2 disorder can be depressed for longer periods, which can cause significant impairment. Although bipolar disorder can occur at any age, typically it's diagnosed in the teenage years or early 20s. Symptoms can vary from person to person, and symptoms may vary over time. Mania and hypomania. Mania and hypomania are 2 distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality, psychosis, and require hospitalization. Hey, Miss Pat, good to see you, love. Hope you're doing well, darling. Both a manic and hypomaniac, I apologize. Hypomanic episode include 3 or more of these symptoms: abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence is euphoric. euphoria. I'm probably pronouncing that wrong, but I don't know. Decreased need for sleep, unusual talkative, racing thoughts, distractibility, poor decision making, for examples, going on buying sprees, taking sexual risk, or making foolish investments. Major depressive episode. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities such as work, school, social activities, or relationships. An episode includes 5 or more of these symptoms. Depressed moods such as feeling sad, empty, hopeless, or tearful in children and teens. Depressed mood can appear as irritability. Hello, BM. Good to see you, love. Hope you're doing well, darling. Mark loss of interest or feeling no pleasure in all or almost all activities. Significant weight loss when not dieting, weight gain or decrease or increase in appetite in children. Failure to gain weight as expected can be a sign of depression. Either insomnia or sleeping too much. Either restlessness or slowed behavior. Fatigue or loss of energy. Feelings of worthlessness or excessive or inappropriate guilt, decreased ability to think or concentrate or indecisiveness, thinking about planning or attempted unaliveness. We'll just say that just in case if it does trigger anybody. I don't mean to, guys. Other features of bipolar disorder. Signs and symptoms of bipolar 1 and bipolar 2 disorders may include other features such as anxious distress, melancholy, psychosis, or others. The timing of symptoms may include diagnostic labels such as mixed or rapid cycling. In addition, bipolar symptoms may occur during pregnancy or change with the seasons. Symptoms in children and teens. Symptoms of bipolar disorder can be difficult to identify in children and teens. It's often hard to tell whether these are normal ups and downs, the result of stress or trauma, or signs of mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of adults, with bipolar disorder, and moods can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. Hello, Miss Potty Mouth. Good to see you, love. Hope you're doing well, darling. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. When to see a doctor. Despite the mood extremes, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives and the lives of their loved ones and don't get the treatment they need. And if you're like some people with bipolar disorder, you may enjoy the feelings of a euphoria and cycles of being more productive. However, this euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship trouble. If you have any symptoms of depression or mania, see your doctor or mental health professional. Bipolar disorder doesn't get better on its own. Getting treatment from a mental health professional with experience in bipolar disorder can help you get your symptoms under control. When to get an emergency help. Unalive thoughts and behavior are common among people with bipolar disorder. If you have thoughts of hurting yourself, call 911 or your local emergency number immediately. Go to an emergency room or confide in a trusted relative or friend, or contact a suicide hotline in the U.S. Call or text 988 to reach the 988 Suicide and Crisis Lifeline, available 24 hours a day, 7 days a week, or use the Lifeline chat. Services are free and confidential. If you have a loved one who is in danger of unaliving themselves or has made an unalive attempt, make sure someone stays with that person. Call 911 or your local emergency number immediately. Or if you think you can do so safely, take the person to the nearest hospital emergency room. This is the causes of bipolar, guys. Hello, Criminal Mag. Good to see you, love. Hope you're doing well, darling. The exact cause of bipolar disorder is unknown, but several factors may be involved, such as biological differences. People with bipolar disorder appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Hello, Pink Fan. Good to see you, love. Hope you're doing well, darling. Thank you guys so much for being in here. Please hit the like. If y'all haven't subscribed, please hit the subscribe button and the share. Thank you guys so much for being in here. And the next cause is genetics. Bipolar disorder is more common in people who have a first degree relative, such as a sibling or a parent. Love you, honey. Good night. With a condition, researchers are trying to find genes that may be involved in causing bipolar disorder. Risk factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include having the first degree relative, such as a parent or sibling with bipolar disorder, periods of high stress, such as the death of a loved one or another traumatic event, drug or alcohol abuse. Complications. Left untreated, bipolar disorder can result in serious problems that affect every area of your life, such as problems related to drug and alcohol use, unalive attempts, legal or financial problems, damaged relationships, poor work or social performance. Co-occurring conditions. If you have bipolar disorder, you may also have another health condition that needs to be treated along with bipolar disorder. Some conditions can worsen bipolar disorder symptoms or make treatment less successful. Examples include anxiety disorders, eating disorders, ADHD, which is attention deficit hyperactivity disorder, alcohol or drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity. Prevention. There's no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of mental health disorder can help prevent bipolar disorder or other mental health conditions from worsening. If you've been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from becoming full-blown episodes of mania or depression. Pay attention to warning signs. Addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episodes and what triggers them. Call your doctor if you're falling into an episode of depression or mania. Involve family members or friends in watching for more warning signs. Avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. Take your medications exactly as directed. You may be tempted to stop treatment, but don't. It's very important to make sure you guys take your medicine. Very, very important, because it could cause issues. It could cause kind of backfiring in a way. It could cause your symptoms to be really, really bad. It could make them really worse. So make sure you take your medicine as the doctor prescribes it. That way you can get better and start to feel a little better. Stop your medication or reducing your dose on your own may cause withdrawal effects, or your symptoms may worsen or return, like I just said, guys. Hold on a second. All right. I can go over this one. I was just thinking it was something. All right. Diagnosis: to determine if you have bipolar disorder, your evaluation may include physical exam. Your doctor may do a physical exam and lab test to identify any medical problems that could be causing your symptoms. Psychiatric assessment. Your doctor may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. You may also fill out a psychological self-assessment or questionnaire. With your permission, family members or close friends may be asked to provide information about your symptoms. Mood charting. You may be asked to keep a daily record of your moods, sleep patterns, or other factors that could help with diagnosis and finding the right treatment. Criteria for bipolar disorder. Your psychiatrist may compare your symptoms with the criteria for bipolar and related disorders in the Diagnostic and Statistical Manual of Mental Disorders, which is DSM-5, published by American Psychiatric Association. Diagnosis in children. Although diagnosis of children and teenagers with bipolar disorder includes the same criteria that are for adults, symptoms in children and teens often have different patterns and may not fit neatly into the diagnostic categories. Also, children who have bipolar disorder are frequently also diagnosed with other mental health conditions such as ADHD or behavior problems, which can make diagnosis more complicated. Referral to a child psychiatrist with experience in bipolar disorder is recommended. Treatment. Treatment is best guided by a medical doctor who specializes in diagnosing and treating mental health conditions, psychiatrist who is skilled in treating bipolar and related disorders. You may have a treatment team that's also included as a psychologist, social worker, and psychiatric nurse. Bipolar disorder is a lifelong condition. Treatment is directed at managing symptoms. Depends on your needs. Treatment may include medications. Often you'll need to start taking medications to balance your moods right away. Continued treatment. Bipolar disorder requires lifelong treatment with medications, even during periods when you feel better. People who skip maintenance treatment are at high risk of relapse of symptoms or having minor mood changes, turning into full-blown mania or depression. Day treatment programs. Your doctor may recommend a day treatment program. These programs provide the support and counseling you need while you get the symptoms under control. Substance abuse treatment. If you have problems with alcohol or drugs, you also need substance abuse treatment. Otherwise, it can be very difficult to manage bipolar disorder. Hospitalization. Your doctor may recommend hospitalization if you're behaving dangerously, you feel unalive, or you become detached from reality, psychotic. Getting psychiatric treatment at a hospital can help you keep calm and safe and stabilize your mood, whether you're having a manic or major depressive episode. The primary treatments for bipolar disorder include medications and psychological counseling, which is psychotherapy, to control symptoms, and also may include education and support groups. Hello, my next to Red. Good to see you, love. Hope you're doing well, darling. Medications, and I'm not going to go over all of them. I'm just going to go I'm not going to repeat the medications. I'll just kind of let you guys, I'll read over it, but I'm not going to repeat the names of the medications. So y'all can see. I think I got it big enough where you guys can see. Hey, Mr. Michigan, good to see you. Because that way I don't get struck or nothing because I'm talking about medicine. So just in case. It says medications may include, you typically need mood stabilizing medications to control manic or hypomanic episodes. And then these are the examples, which I won't say, but y'all can see it on there. Antipsychotics, if symptoms of depression or mania persist in spite of treatment with other medications, and antipsychotic drugs such as, and then these, and it says your doctor may prescribe some of these medications alone or along with a mood stabilizer. And there's a list of them, guys. I won't say it, but y'all, if y'all are interested, y'all can read them. I'll leave them up for just a second. So if y'all want to read them, just in case. I just don't want to be struck because I'm trying to bring awareness. I just don't want to get in trouble. Antidepressants. Your doctor may add an antidepressant to help manage depression because an antidepressant can sometimes trigger a manic episode. It usually prescribes along with a mood stabilizer or antipsychotic. Antidepressive, antipsychotic. This medication that combines the antidepressant and the antipsychotic. It works as a depression treatment and a mood stabilizer. Anti-anxiety medications, you see the name, may help with anxiety and improve sleep, but are usually used on short-term basis. It says finding the right medication. Finding the right medication or medications for you will likely take some trial and error. If one doesn't work well for you, there are several others to try. This is a process that requires patience, as some medications need weeks to months to take fully effect. Generally, only one medication is changed at a time, so your doctor can identify which medications work to relieve your symptoms with the least bothersome side effects. Medications also may need to be adjusted as your symptoms change. This is the side effects. Mild side effects often improve as you find the right medications and doses that work for you, and your body adjusts to medications. Talk to your doctor. Talk to your doctor or mental health professional if you have bothersome side effects. Don't make changes or stop taking your medications. If you stop your medication, you may experience withdrawal effects, or your symptoms may worsen or return. You may become very depressed, feel unalivable, or go to a manic or hypomanic episode. If you think you need to make a change, call your doctor. Medications and pregnancy. A number of medications for bipolar disorder can be associated with birth defects and can pass through breast milk to your baby. Certain medications, such as that should not be used during pregnancy. Also, birth control medications may lose effectiveness when taken along with certain bipolar disorder medications. Discuss treatment options with your doctor before you become pregnant, if possible. If you're taking medications to treat your bipolar disorder and think you may be pregnant, talk to your doctor right away. It's very important, guys. Psychotherapy. Psychotherapy is a vital part of bipolar disorder treatment and can be provided in individual, family, or group settings. Several types of therapy may be helpful. These include interpersonal and social rhythm therapy, which is IPSRT. IPSRT focuses on the stabilization of daily rhythms such as sleeping, walking, and meal times. A consistent routine allows for better mood management. People with bipolar disorder may benefit from establishing a daily routine for sleep, diet, and exercise. A cognitive behavior therapy, or CBT. The focus is identifying unhealthy negative beliefs and behaviors and replacing them with healthy, positive ones. CBT can help identify what triggers your bipolar episodes. You also learn effective strategies to manage stress and to cope with upsetting situations. Psychoeducation, learning about bipolar disorder, which is psychoeducation, kind of like what we're doing right now in a way, can help you and your loved ones understand the condition. Knowing what's going on can help you get the best support, identifying issues, make a plan to prevent relapse, and stick with the treatment. Family focused therapy. Family support and communication can help you stick with your treatment plan and help you and your loved ones recognize and manage warning signs of mood swings. Other treatment options, depending on your needs, other treatments may be added to your depression therapy. During electroconvulsive therapy, or ECT, electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can reverse symptoms of certain mental illnesses. ECT may be an option for bipolar treatment if you don't get better with medications, can't take antidepressants for health reasons such as pregnancy, or a high risk of unaliving yourself. Yes, absolutely, small time girl. Mothers with bipolar disorder, you can still have healthy babies. Just please speak with your doctor. Absolutely, honey. Absolutely, guys. Transcranial magnetic stimulation, which is TMS, is being investigated as an option for those who haven't responded to antidepressants. Treatment in children and teenagers. Treatment for children and teenagers are generally decided on a case-by-case basis, depending on symptoms, medication side effects, and other factors. Generally, treatment includes medications. Children and teens with bipolar disorder are often prescribed the same types of medications as those used in adults. There's less research on the safety and effectiveness of bipolar medications in children than in adults, so treatment decisions are often based on adult research. Psychotherapy, initial and long-term therapy, can help keep symptoms from returning. Psychotherapy can help children and teens manage their routines, develop coping skills, address learning difficulties, resolve social problems, and help strengthen family bonds and communication. And if needed, it can help treat substance abuse problems common in older children and teens with bipolar disorder. Psychoeducation. Psychoeducation can include learning the symptoms of bipolar disorder and how they differ from behavior related to your child's developmental age, the situation, and appropriate cultural behavior. Understanding about bipolar disorder can also help you support your child. Support, working with teachers and school counselors and encouraging support from family and friends can help identify services and encourage success. And get a sip of drink, guys. Absolutely, Pink Fan. Anybody struggling, please reach out and seek help. Absolutely, because your life matters and you are very important and you are loved and you are cared about and you are not alone in this world. Trust me, there are plenty of people that care about you and love you and are here for you. I'm one of them. You might not know me personally, but that's also a good thing because you can I'm here for each and every one of you guys. So it's always good to talk to somebody that don't really know. It's kind of like a counselor, but not a counselor. Like they don't really know exactly what you're going through, but they can still be there for you. You know, some people call me life coach. I do not claim as a life coach. I just want to say that right now. But some people call me that. I do not claim that at all. But y'all call me whatever you want to call me. It says lifestyle and home remedies. You'll probably need to make lifestyle changes to stop cycles of behavior that worsen your bipolar disorder. Here are some steps to take. Quit drinking or using recreational drugs. One of the biggest concerns with bipolar disorder is the negative consequences of risk-taking behavior and drug or alcohol abuse. Get help if you're having trouble quitting on your own. Form healthy relationships. Surround yourself with people who are a positive influence. Friend and family members can provide support and help you watch for warning signs of mood shifts. Create a healthy routine. Having a regular routine for sleeping, eating, and physical activity can help balance your moods. Check with your doctor before starting any exercise program. Eat a healthy diet. If you take that word, talk to your doctor about appropriate fluid and salt intake. If you have trouble sleeping, talk to your doctor or mental health professional about what you can do. Check first before taking other medications. Call the doctor who's treating you for bipolar disorder before you take medications prescribed by another doctor or any over-the-counter supplements or medications. Sometimes other medications trigger episodes of depression or mania or may interfere with medications you're taking for bipolar disorder. Consider keeping a mood chart. Keeping a record of your daily moods, treatments, sleep activities, and feelings may help identify triggers, effective treatment options, and when treatment needs to be adjusted. Alternative medicine. There isn't much research on alternative or complementary medicine, sometimes called integrative medicine, and bipolar disorder. Most of the studies are on major depression, so it isn't clear how these non-traditional approaches work for bipolar disorder. If you choose to use alternative or complementary medicine in addition to your physician recommended treatment, take some precautions first. Don't stop taking your prescribed medications or skip therapy sessions. Alternative or complementary medicine is not a substitute for regular medical care when it comes to be treated for bipolar disorder. Be honest with your doctors and mental health professionals. Tell them exactly which alternative or complementary treatments you use or would like to try. Beware of potential dangers. Alternative and complementary products aren't regulated the way prescription drugs are. Just because it is natural doesn't mean it's safe. Before using alternative or complementary medicine, talk to your doctor about the risk, including possible serious interactions with medication. Coping and support. Coping with bipolar disorder can be challenging. Here are some strategies that can help. Learn about bipolar disorder. Education about your condition can empower you and motivate you to stick to your treatment plan and recognize mood changes. Help educate your family and friends about what you're going through. Stay focused on your goals. Learning to manage bipolar disorder can take time. Stay motivated by keeping your goals in mind and reminding yourself that you can work to repair damaged relationships and other problems caused by your mood swings. Join a support groups for people with bipolar disorder, or like here, support one another. As I say, support one another, lift each other up. This is not just straight a mental health stream. This is for everybody. It says support groups for people with bipolar disorder can help you connect to others facing similar challenges and share experiences. Find healthy outlets. Explore healthy ways to channel your energy, such as hobbies, exercise, and recreational activities. Learn ways to relax and manage stress. Yoga, Tai Chi, massage, meditation, or other relaxation techniques can be helpful. You're welcome, hippie grandma. Says preparing for your appointment. You may start by seeing your primary care doctor or psychiatrist. You may want to take a family member or friend along with your appointment, if possible, for support and to help remember information. What you can do before your appointment: make a list of any symptoms you've had, including any of that may seem unrelated to the reason for the appointment. Key personal information, including any major stresses or recent life changes. All medications, vitamins, herbs, or other supplements you're taking, and dosage. Questions to ask your doctor. Some questions to ask your doctor may include: do I have bipolar disorder? Are there any other possible causes for my symptoms? What kind of tests will I need? What treatments are available? Which do you recommend for me? What side effects are possible with that treatment? What are the alternatives to the primary approach that you're suggesting? I have these other health conditions. How can I best manage these conditions together? Should I see a psychiatrist or other mental health professional? Is there a genetic alternative to the medicine you're prescribing? Are there any brochures or other printed material that I can have? What websites do you recommend? Don't hesitate to ask other questions during your appointment. It's never like, as the old saying goes, what is it like? You never know until you ask. You can never ask too many questions, especially when it concerns your health. Your health is very important. So I would ask all the questions that you possibly could. Whatever pops in your head, because your health is very important. What to expect from your doctor. And your doctor will likely ask you a number of questions. Be ready to answer them, to reserve time to go over any points you want to focus on. Your doctor may ask: when did you or your loved ones first begin noticing your symptoms? How frequently do your moods change? Do you ever have unalive thoughts when you're feeling down? Do your symptoms interfere with your daily life or relationships? Do you have any blood relatives with bipolar disorder or depression? What other mental or physical health conditions do you have? Do you drink alcohol, smoke cigarettes, or use recreational drugs? How much do you sleep at night? Does it change over time? Do you go through periods when you take risks that you wouldn't normally take, such as unsafe sex or unwise, spontaneous financial decisions? What, if anything, seems to improve your symptoms? What, if anything, appears to worsen your symptoms? Absolutely, they do, Pink Fan. I love you, honey, and I'm always here for you, darling, if you need me. All right, guys, and that's all on that info, but I have a couple more, and that was a lot of information, and hopefully that's helped so far. Hopefully that's helped, guys. Shed a little bit more light to what it is. All right. Helping someone with bipolar disorder. This is a biggie, guys. If you know somebody, I mean, this is just this is an advice. This is a support one. I thought this was an excellent one, especially if you know somebody that's suffering with bipolar disorder. You can kind of more be there for them. If maybe you might be able to help yourself, or help a family member or help a friend, or you can, since we know a little bit more about it, this is helping somebody with bipolar disorder, helping somebody. Absolutely, it takes work. Rome wasn't built in a day, and it is very hard. Trust me, I'm in counseling, and my counseling is getting ready. My counselor is getting ready to retire. So I have to go through my story all over again. And I hate it. I absolutely hate it, guys, because, it sucks to tell your story. over again and over again. You'd rather just say it one time and be done with it. But my counselor's getting ready to retire. So unfortunately I have to kind of relive it, the pain. And it is terrible, guys. It is terrible. And absolutely, I'm dreading it, really. But this is to help somebody that you know. If you know somebody that's suffering with it, you might be able to help them better. If you suffer with it, you might be able to help yourself, or family members. Just anybody to help. If anybody suffers with it, anybody to help somebody else. So I thought this was very useful information, and I did some massive digging to find some that's really good information. So definitely, this is definitely good. This is all good information, but this is a definitely big one, because I know a lot of people suffer and their families don't know what to do to help them. You know what I mean? Or they're, they have friends and their friends don't know what to do to help them. You know what I mean? So this is a big one. I think this is going to be a huge help for a lot of people. A lot of people. It says helping someone with bipolar disorder. Dealing with a loved one's bipolar disorder isn't easy. This guide will help you navigate the challenges and support your friend or family member. Oh, I'm so sorry, Criminal Med, darling. I'm sorry, sweetheart. How can you help someone with bipolar disorder? I know it sucks. I know it does suck. I mean, we don't like gynecologists either. Sorry, guys, if you are listening, but I'm just saying we don't like them either. Y'all know, us women, we don't. But I'm telling you, I just hate that you have to kind of relive it because they want to hear your story. And I'm like, I don't want to say my story because it's kind of like it hurts. Y'all know what I'm saying? It hurts to say it all over again. It's like you're reliving it all over again, and you don't want to relive it. You want to move past it and get better. But then when you have to see a different doctor, you have to see a different counselor, or whatever the case may be, then you have to go over it all over again. And it's absolutely traumatizing. I mean, on my end, it's absolutely traumatizing. So I'm kind of dreading it, honestly. I'm kind of dreading it. And she retires on the 29th of this month. So it's right around the corner. I mean, yeah, it's right around the corner. Absolutely. Yeah, it's kind of scaring me because she's been my counselor for like 4 or 5 years. So I'm really kind of dreading it, guys. I really honestly am. And she specializes in PTSD and traumatic patients. Like certain counselors, they specialize in a specific thing. Well, my counselor specializes in PTSD traumatic patients, and she does the EDMR, where you hold the trigger, the little buzzards in your hand, and you can kind of clear your mind of certain things. Yeah. So I'm like, that sucked. All right. How can you help someone with bipolar disorder? Dealing with the ups and downs of bipolar disorder can be difficult, and not just for the person with the illness. The moods and behaviors of a person with bipolar disorder affect everyone around, especially family members and close friends. It can put a strain on your relationship and disrupt all aspects of family life. During a manic episode, you may have to cope with reckless antics, outrageous demands, explosive outbursts, and irresponsible decisions. And once the whirlwind of mania has passed, it often falls on you to deal with the consequences. During episodes of depression, you may have to pick up the slack for a loved one who doesn't have the energy to meet responsibilities at home or work. I hope so too, honey. I really, truly do. And I told her, no offense to men, but it's just, I told her that I prefer a woman, but if I have to have a man, everybody's comfortable with their own, what they pick. You know what I'm saying? So, I don't know. The good news is that most people with bipolar disorder can stabilize their moods with proper treatment, medication, and support. Your patient love and understanding can play a significant part in your loved one's treatment and recovery. Often just having someone to talk to can make all the difference in their outlook and motivation. Well, gosh, I hope not. I mean, I hope she does and I don't have to relive it. You know what I'm saying, Mr. Michigan? I hope I don't have to, because it is very traumatizing. I hope not. Um, But caring for a person with bipolar disorder can also take a toll if you neglect your own needs. So it's important to find a balance between supporting your loved one and taking care of yourself. Other ways to help someone with bipolar disorder. You can also support your loved one by learning about bipolar disorder, kind of like what we did earlier. Learn everything you can about the symptoms and treatment options. The more you know about bipolar disorder, the better equipped you'll be to help your loved one and keep things in perspective. Encouraging the person to get help. The sooner bipolar disorder is treated, the better the prognosis. So urge your loved one to seek professional help right away. Don't wait to see if it will get better without treatment, because it won't. They said it's not treatable without treatment. Remember what we went over a few minutes ago. Being understanding. Let your friend or family member know that you are there if they need sympathetic ear, encouragement, or assistance with treatment. People with bipolar disorder are often reluctant to seek help because they don't want to feel like a burden to others. So remind the person that you care and you'll do whatever you can to help them. Showing patience. Get better takes time, even when the person is committed to treatment. Don't expect a quick recovery or a permanent cure. Be patient with the pace of recovery and prepare for setbacks and challenges. Managing bipolar disorder is a lifelong process. The importance of support in bipolar disorder recovery. People with bipolar disorder do better when they have support from family members and friends. They tend to recover more quickly, experience fewer manic and depressive episodes, and have milder symptoms. Well, I hope so, Mr. Michigan. I sure hope so. To be like, I hope so. Hi, Jennifer B. Good to see you, love. Hope you're doing well, darling. Well, I'm coming over to your house. What are you cooking, love? It says bipolar disorder and the family. Living with a person who has bipolar disorder can cause stress and tension in the home, on top of the challenge of dealing with your loved one's symptoms and their consequences. Family members often struggle with feelings of guilt, fear, anger, and helplessness. Ultimately, the strain can cause serious relationships problems, but there are better ways to cope. The first step to successfully dealing with bipolar disorder is for families to learn to accept the illness and its difficulties. When you're feeling frustrated or guilty, remember that bipolar disorder isn't anyone's fault. Accepting bipolar disorder involves acknowledging that things may never be normal again. Hey, Dumpling, good to see you, hon. Hope you're doing well. Treatment can make a huge difference for your loved one, but it may not take care of all the symptoms and impairments. To avoid disappointment and resentment, it's important to have realistic expectations. Expecting too much of your family member can be a recipe for failure. On the other hand, expecting too little can also hinder their recovery. So try to find a balance between encouraging independence and providing support. Fried taters and eggs. Anytime is breakfast time. Absolutely, honey. Hello, Sub-Zero. Good to see you, hon. I hope you're doing well, darling. Tips for coping with bipolar disorder in the family. Accept your loved one's limits. Your loved one with bipolar disorder can't control their moods. They can't just snap out of depression or get a hold of themselves during a manic episode. Neither depression nor mania can be overcome through self-control, willpower, or reasoning. So telling your loved one to stop acting crazy or to go look on the bright side won't help. Accept your own limits. You can't rescue your loved one with bipolar disorder, nor can you force them to take responsibility for getting better. You can offer support, but ultimately, recovery is in the hands of the person with the illness. Reduce stress. Stress makes bipolar disorder worse. So try to find ways to reduce stress in your loved one's life. Ask how you can help and volunteer to take over some person's responsibilities if needed. Establishing and enforcing a daily routine with regular times for getting up, having meals, and going to bed can also reduce family stress. Communicate openly. Open and honest communication is essential to coping with bipolar disorder in the family. Share your concerns in a loving way. Ask your loved one how they're feeling and make an effort to truly listen, even if you disagree with your loved one or don't relate to what's being said. This is supporting a person with bipolar disorder. What you can say that helps. You're not alone in this. I'm here for you. Understand that your illness that causes these thoughts and feelings. You may not believe it now, but the way you're feeling can and will change. I may not be able to understand exactly how you feel, but I care about you and want to help and support you. You are important to me. Your life is important to me. Convincing a person with bipolar disorder to see a doctor. Aside from offering emotional support, the best way to help your loved one with bipolar disorder is by encouraging and supporting treatment. Often that can be more of a challenge than it sounds, since people with bipolar disorder tend to lack insight into their condition. It's not always easy to get them to a doctor. When your loved one is manic, they feel great and don't realize there's a problem. When your loved one is depressed, they may recognize something's wrong, but often lack the energy to seek help. If your loved one won't acknowledge the possibility of bipolar disorder, don't argue about it. The idea may be frightening to them, so be sensitive. Suggest a routine medical checkup instead, or a doctor's visit for a specific symptom, such as insomnia, irritability, or fatigue. Then privately call ahead and tell the doctor of your concerns about bipolar disorder. Things you can say that might help. Bipolar disorder is a real illness like diabetes. It requires medical treatment. You're not to blame for bipolar disorder. You didn't cause it. It's not your fault. You can feel better. There are many treatments that can help. When bipolar disorder isn't treated, it usually gets worse. Supporting a loved one during bipolar disorder treatment. Once your friend or family member agrees to see a doctor, you can help by being a partner in treatment. Your support can make a big difference in their treatment success. So offer to be involved in any way your loved one wants or needs. Things you can do to support a loved one's bipolar disorder treatment. Find qualified doctors and therapists. Set up appointments and go along. Offer your insights to the doctor. Monitor your loved one's moods. Learn about their medication. Track treatment progress. Watch for signs of relapse. Alert the doctor to problems. Encourage your loved ones to take bipolar disorder medication. Medication is the cornerstone of treatment for bipolar disorder, and most people need to regulate their moods and avoid relapse. Despite the need for medication, many people with bipolar disorder stop taking it. Some quit because they're feeling better, others because of side effects, and yet others because they enjoy the symptoms of mania. People who don't think they have a problem are particularly likely to stop taking medication. You can help your loved ones stay on track by emphasizing the importance of medication and make sure they take all prescriptions as directed. Also encourage your loved one to speak to their doctor about any bothersome side effects. Side effects can be very unpleasant if the dose of medication is too high or too low, but a change in medication or dosage may solve the problem. Remind your loved one that abruptly stopping medication is dangerous. Hello, Kenzie C. Good to see you, love. I hope you're doing well, darling. Watch for warning signs of bipolar disorder relapse. Well, maybe you can help her, Miss Julie, since you found maybe this might help you help her. I mean, it's worth a try. You never know till you try. Watch for warning signs of bipolar disorder relapse. Even if your loved ones with bipolar disorder is committing to treatment, there may be times when their symptoms get worse. Take action right away if you notice any troubling symptoms or mood changes. Point out the emerging bipolar symptoms to your loved one and alert the doctor. With shift intervention, you may be able to prevent an episode of mania or depression from developing fully. Mania warning signs and symptoms: sleeping less, elevated mood, restlessness, speaking rapidly, increase in activity level, irritability or aggression. Depression warning signs and symptoms: fatigue and lethargy, sleeping more, trouble concentrating, loss of interest in activities, withdrawing from others, and change in appetite. Coping with mania and depression, tips for family and friends. If it's not possible to prevent your loved one from relapsing, there are things you can do to cope during a manic or depressive episode. Don't take bipolar symptoms personally. When in the midst of a bipolar episode, people often say or do things that are hurtful or embarrassing. When manic, your loved one may be reckless, cruel, critical, and aggressive. When depressed, they may be rejecting, irritable, hostile, and moody. It's hard not to take such behaviors personally, but try to remember that they're symptoms of your loved one are of your loved one's mental illness, not the result of selfishness or immaturity. Be prepared for destructive behaviors. When manic or depressed people with bipolar disorder may behave in destructive or irresponsible ways, planning ahead for how to handle such behavior can help. When your loved one is well, ne- nego- negotiate. When I can't even talk. Negotiate a treatment contract that gives you advance approval, protecting them when symptoms flare up. Agree on specific steps you take, such as removing credit cards or car keys, going together to the doctor, or taking charge of financial or household finances. Know what to do in a crisis. It's important to plan ahead for times of crisis so you can act quickly and effectively when it occurs. Having a crisis plan can help. Make sure to include a list of emergency contact information for doctors, therapists, and other friends or family members who will help. Also include the address and phone number of the hospital where you'll take your loved one if necessary. Call 911 or your country's emergency services number in an emergency. If your loved one with bipolar disorder is unreliable or violent, try not to handle the situation alone. If you're worried that your loved one may hurt you, get to safety and then call the police. If your loved one is unreliable, don't leave them alone. Call for an ambulance and stay with your loved one until it arrives. Hey, Rebel. Says support someone who is manic. Spend time with your loved one. People who are manic often feel isolated from other people. Spending even short periods of time with them helps. If your loved one has a lot of energy, walk together. This allows your loved one to keep on the move but still share your company. Answer questions honestly. However, do not argue or debate with someone during a manic episode. Try to avoid intense conversation. Do not take any comments personally. During manic episodes, your loved one may say or do things that are out of character, including focusing on negative aspects of others. Try to avoid arguments. Prepare easy to eat meals and drinks. It's often difficult for someone who is manic to sit down to a meal. So try offering them sandwiches, apples, cheese crackers, and juices, for example. Hello, Sharon. Good to see you, love. Hope you're doing well, darling. Avoid subjecting your loved one to a lot of activity and stimulation. It's better to keep your surroundings as quiet as possible. Allow your loved one to sleep whenever possible. During periods of high energy, sleeping is difficult, but short naps taken throughout the day can help. Sometimes a person who is manic may feel rested after only a few hours of sleep. Taking care of yourself when a loved one has bipolar disorder. Now, this is big too, guys, because it can be, it can be draining. Um, you know, especially when you're trying to help them and you don't know what to do. It's easy to neglect your own needs when you're supporting someone with a mental illness, but if you don't take care of yourself, you'll run the risk of a burnout, and that won't help you or your loved one. When you take care of yourself, both emotionally and physically, you'll be able to better cope with the stress of caring for someone with bipolar disorder, and you have the energy you need to support your loved one's recovery. Absolutely, Criminal Man. Focus on your own life. Supporting your loved one may involve some life adjustments, but make sure you don't lose sight of your own goals and priorities. Don't give up your friendships, plans, or activities that bring you joy. Seek support. Dealing with a loved one's mental illness can be painful and isolating. Make sure you're getting the emotional support you need to cope. Talk to someone you trust about what you're going through. It can also help you get your own therapy or join a support group. Set boundaries. Be realistic about the amount of care you're able to provide without feeling overwhelmed and resentful. Set limits on what you're you're willing and able to do and stick to them. Letting bipolar disorder take over your life isn't healthy for you or your loved one. Manage stress. Stress takes a toll on your body and mind, so find ways to just keep it in check. Make sure you're eating right and getting enough sleep and exercise. You can also keep stress under control by practicing relaxation techniques such as meditation. Ask for help if your friend or family needs more assistance than you can give. Ask for help from others. Turn to other relatives or close friends or contact a bipolar disorder support organizations. All right. And the next one is the positivity one, guys. Because I told you I was going to go over the awareness of what it was. And then we was going to go over kind of, if the support, which is what this is. And now we're going over the positivity. See, I told you it was positivity. It says living with bipolar disorder strategies and habits to help you stay positive. See? So we got support and awareness, and positivity. And also support and awareness. So it's kind of like we got mental health, support and awareness, and positivity all in one show, guys. All in one show. All right, this one is psychcentral.com. And in the search bar, it's bipolar strategies to stay positive. And it took me a while to find this one too, because I was like, all I found was like, information and negativity. I was like, I'm bound to find something positive. So I did some digging. And I was like, okay, cool. I got it. All right, living with bipolar disorder, strategies and habits to help you stay positive if you have it. Living with a condition of extreme mood shifts can put a strain on everyday life, but learning how to recognize your feelings and celebrate your accomplishments can encourage a positive outlook. Bipolar disorder is an inclusive term for bipolar 1 and 2 disorders and synthomania. I'm probably pronouncing that wrong. Conditions that feature episodes of mania, hypomania, and periods of clinical depression. The often severe mood changes in bipolar disorder can create a number of interpersonal and everyday challenges. You might find relationships don't last, for example, or employment is nearly impossible to maintain. You don't choose to live with bipolar disorder, and it's natural to feel distressed at how symptoms negatively impact your life. When things feel at their worst, however, there are ways you can help. You can help find a positive mindset. Find a positive mindset and stay in it. Daily lifestyle habits to help stay positive. A positive mindset doesn't mean you have to be happy all the time. Positivity is simply a path of thinking that focuses on success rather than failure. It tends to align with optimism, which means you have a general sense of future outcomes will be in your favor. You can build positively slowly or use it as a go-to when you're feeling overwhelmed. Learn to find strengths in bipolar disorder. Positivity can start with the proverbial silver lining to bipolar disorder. According to Katie Borick, MSW-RSW, director at Aligned Minds Counseling and Therapy in Edmonton, Canada, finding the strengths in bipolar disorder can help you view the condition in a positive light. This is not meant to be dismissive of struggles faced when you have bipolar disorder. She says because of the struggles you face living with bipolar, you may have developed resistance and empathy. Maybe you have also developed your own creative ways to cope. Forming your support network. When you feel like no one understands or cares, it can be easy to slide down into a pool of negative emotions. Having a support network, be it family, friends, or an organized group of others, can be a helpful reminder that you're not alone. People do care. People do share this experience. Collaborating with your support network to schedule regular check-ins, visits, and communication can eliminate the chances of feeling forgotten if someone hasn't called in a while. Support groups are a great way to find encouragement and inspiration from other people who are also living with bipolar disorder, says Boric. Your support group can also be a great source of new coping skills that have been tested by others. Checking in with yourself. Just as check-ins from others can encourage positivity, learning to check in with yourself can also help you know when to focus on positivity. Use constant check-ins when you may feel unusually depressed or high energy that day, suggests Kevin Coleman, LMFT-A, owner of Connected Therapy Practice in Columbia, South Carolina. You can do this through journaling. Coleman suggests answering the questions in your journal once a day. How sad am I feeling today on a scale of 1 to 10? How good am I feeling today on a scale of 1 to 10? Is this significantly different than a few days ago? Why might that be? Answering these questions can help you see your emotional patterns and may help you recognize when you might be entering a mood episode. Setting achievable goals. Completing a task can make you feel accomplished, empowered, and productive. Breaking big tasks into smaller tasks can assure you feel the sense of accomplishment, even if the overall job hasn't gotten done. You can also set rewards for yourself to reinforce a positive vibe. Setting achievable goals can help you feel more in control of your life and promote positive feelings, explains Megan Tangrandi, LPC LCADC, Clinical Director and Achieve Wellness and Recovery in Northfield, New Jersey. Healthy lifestyle with or without bipolar disorder. Many of lifestyle habits that can promote a positive mindset are universal, regardless of your mental health state. To promote positivity and manage symptoms of bipolar disorder, it is vital to adopt a healthy lifestyle that supports well-being, explains Dr. John Schwitz, a board-certified psychiatrist and medical director at Monterey Behavior Health in Los Angeles, California. He says that regular sleep and exercise are critical for regulating mood changes and improving overall health, and a well-balanced and nutritious diet can provide the body and brain with the energy and nutrients necessary for optimal functioning. Coping strategies for in the moment. If you're feeling overwhelmed by negativity in any given moment, it's not too late to pull yourself out. Disconnecting from social media. Boric recommends taking a break from social media. She explains that stress-related searches can often trigger algorithms that show you more negative stress-related things. Having a go-to physical activity. Can't shake the negativity? Shaywitz suggests having a physical activity you can engage in to release endorphins and encourage relaxation. This could be yoga, going for a walk, or dancing to your favorite music. Doing deep breathing. Taking a few minutes each day to practice deep breathing exercises can help improve focus, suggests Tangradi. This can be done in any comfortable position and consists of breathing deeply, slowly, and even to create a calming effect. Practicing mindfulness. Mindfulness is a skill that involves an in-the-moment awareness, acceptance, and release of thoughts and emotions without dwelling on them. According to a 2018 study, mindfulness can promote present moment acceptance and encourage positive emotions in daily life. Hey, Miss Ann, good to see you, love. I hope you're doing well, darling. Says what to avoid to stay positive in bipolar disorder. While there are a number of things to do to stay positive with bipolar disorder, there are also things that you should avoid doing. Shaywitz recommends that people living with bipolar disorder avoid substance misuse, like sleep, high stress situations, sudden changes in routine, skipping medication, and isolation. Tangradi adds that one should avoid skipping out on self care. It's essential to make time for yourself to practice positive lifestyle habits such as getting enough sleep, engaging in enjoyable activities, and eating nutritious foods. Takeaway: living with bipolar disorder can be challenging, and it's okay to not feel positive all the time. You can work towards a positive mindset in small ways, but it often starts with self kindness, which I have covered a couple weeks back, or like self awareness, which is the same thing. And lastly, be kind and kind to yourself. Shaywitz says bipolar disorder can be a long journey, but remember that recovery is possible. Try to focus on the positive and remind yourself that you're doing the best you can. There we go. You're welcome, honey. Hey, Wild Angel. Hey, BM. Good to see you, ladies. I hope y'all are having a wonderful Tuesday night. All right, guys. Well, so we covered, that was a lot. So I think we got a better, more concept of understanding bipolar disorder. I Miss Ann said my dogs are bipolar. Well, they could be, especially if a CAT is close by. If a CAT is close by, yep, they're bipolar. They're all over the place. Oh, Lord have mercy. All right, guys. So hopefully y'all better understand that. Like I said, we went over what bipolar was. We covered oh, Lord have mercy, what bipolar was, and kind of like what it was all about, like understanding what it is. We covered how to be there for somebody if they suffer with bipolar, like as a friend or family or whatever, coworker, whatever. How to be there for somebody, how to support somebody, and we covered how to be positive if you live with it, or if you know somebody that suffers with it, or you yourself suffers with it. So, like I said, that's what I'm going to start doing on the mental health. I'm going to start doing, like, if I bring, understand, and if I bring up information about a specific topic, whether it be depression, PTSD, or whatever, then I'm going to always try my best to find support if I can find it, like how to support somebody with it if I can find it, and always try to find the positivity of whatever I'm talking about. So that's why we turn our negative. If somebody that suffers with it, whatever you're doing, I'm not really for sure yet, honey, Miss Ann, whatever you're doing on, like whatever you suffer with, which is kind of a negative, but it's a part of you. So it's not your fault. You're not alone. Everybody goes through it. I mean, not everybody, but there's a good majority of the United States and the world that has some kind of mental health condition. So I just want to let you guys know that you're not alone in the world. I mean, everybody has their own, their own illnesses and stuff that they suffer with. But just know, we are here for you guys. We're here to support one another, to lift each other up. We might not fully understand what you're going through, but that's what a support is all about. It's a supporting one another. It's being there for one another. It's lifting each other up in the hard times and in the good times, and just knowing that you're cared and you're loved for and you're important and you matter. That's the main thing. And to get help, and please, your health is very important. Please get the help, because your life is important and you matter and you are not alone. So please get the help that you need. It is very important to your life, to the people that love you, to the people that care about you. It is very important to get the help that you need. And as the information I went over tonight, you can have, you don't have to go through it alone. You can have friends and family go with you and be support system with you, so you're not by yourself. So don't think, well, I'm never going to do this because I don't want to do it on my own. Trust me, if your friends and family love you, like I'm sure they do, They will stick by you through thick and thin. And if you ask them to go with you, I'm sure that they will figure out a way to go with you and support you if you need them to, because that's what it's all about. You're supposed to lift each other up. You're supposed to be there for one another. And you're supposed to, be the good in somebody's life. You're supposed to let them know that they matter and that they're loved and that they're cared for and their life is precious and they deserve to be here. So I mean, like, just stuff like this, it just touches my heart. I personally, like I said, I don't know if I'm diagnosed with it or not, but I suffer with a lot of mental health. So, and this is a form of depression, and I really suffer with depression. So I'm just letting you guys know, y'all are strong, you're survivors. Just please get the help. Please, you're not alone. Like I said, please ask a friend, a family member, or somebody to go with you and get the help that you need for your own well-being, to better yourself so you can be yourself again, because mental health is hell. And if you don't get help, and if you don't try to be yourself again with counseling or medication or however you do it to get the help that you need, it sucks. It's pure hell living with it if you don't try to better yourself and get the help that you need. It sucks. So, I'm just saying, your life matters and you matter and you're very important and you're loved and you're cared for and you're here for a reason. You might have went through hell in half of Georgia. And, I'm just saying this, men and women both suffer with bipolar. It's not just women. It's everybody. Everybody suffers with mental health. It doesn't matter if you're man, woman. It doesn't matter. Mental health knows no genders. Like, it doesn't matter. I mean, that's just my personal opinion, guys. I'm just saying, it's not just women that suffer with mental health. Men also suffer with it as well. So I'm saying in general, I'm saying for everybody, please, your life is important and you matter, and please get the help that you need, whether you are male or female. It doesn't matter. You are very important. You are very important. And your life matters. So please get the help that you need. Please. So I mean, like I said, I suffer. So I know what kind of hell it is on a daily. I might not suffer with bipolar because I don't know if they diagnosed me with it or not, but I'm just saying, you matter. You are very important. Your life is very important and you matter. Let's see. Now let me go through my comments. My therapy is being by the water with a fishing pole. My therapy is being by the water with a fishing pole in hand and just listening to the sounds of nature. If I were, I find myself when times are tough. Hey, that sounds like just a calming place. You just need to find your like serenity zone, if that makes sense. It's just something to be yourself and kind of clear your mind if you can. Just to clear that mind. And that's the main thing. Absolutely, Gone Girl. Absolutely, sweetheart. Let me go back. Absolutely. She said there is help, and there is a bunch of help out there, guys. But it's up to you. And I'm saying, I mean, like, I'm not really saying it's up to you by yourself, but it's really up to you, because you know what you're going through, not nobody else. You. And that's what I'm saying. Like, people can go with you, but what it boils down to is if you want the help. And if you want the help, people will go with you. All you have to do is ask them. Say, hey, I don't feel comfortable going by myself because, I don't feel comfortable talking about this to a doctor, or I'm really nervous because I don't know what to expect, or whatever the case may be. I'm sure, like I said, if your family member or friend cares about you and loves you, which I'm sure they do, if that's a true friend, and I'm sure your family loves you and cares about you, but if that's a true friend, then they're going to support you whether you know, what through whatever through whatever, because that's what real people are supposed to do. That's what good people are supposed to do. That's what your support system is supposed to do. Be there for you and lift you up and help you every step of the way. You know, it just say it's okay to not be okay. You're not alone, but I am here for you. I am here for you. I will listen to you. I might not understand what you're going through, but I will listen to you and I will be there to listen to you ramp and rave or whatever the case may be. I will listen to you and I will give you a words of advice, encouragement. If you need somebody to go to the doctor, I will go to the doctor with you. Whatever the case may be, just show them support and that they matter, because I mean, like I'm just saying, if you don't have if you do not have the support system, or it feels like you're going through it by yourself, so therefore you're going to beat yourself up more because you're like, okay, nobody cares about me, I'm going through all this stuff by myself. You know what I'm saying? you know that's how okay, I suffer with it. So I mean, if I didn't have a support system, which I have a lot of you guys, and then of course I have Rebel and I have my mom, if I didn't have them, I'd be like, oh, I don't know what to do. Like I don't have anybody, and I don't know how to cope with this. And then that's sometimes when bad things happen. And I want people to realize that they're very important. Their life matters. Please, guys, please. You hear so much sad things that happen every day. And I just want to bring awareness out there and let people know, please, your life is very important and you matter. If I could rip out my heart and show you that I'm telling the God's honest truth and I'm as real as they come, I would let you guys know, please. It's not, I'm not really begging, but I'm just letting you guys know that your life is very important. And please get the help that you need, because you deserve to be here. You deserve to live a happy life. I mean, granted, you might suffer with mental health, but there's a lot of people that do and still try the best they can. That's all you can do, is just try your very best and try your best to stay positive. That's all you can do. Just try your very best, because you are a strong person. To what you've gone through, and a lot of people go through a lot of shit. I mean, to be honest with you, that suffer with mental health, especially me. I'm just saying, I suffer with PTSD real bad, and I've went through a lot of shit, and I have it now. But I'm just saying, long story short, it's like it sucks. It sucks. So it is great to have a support system, have somebody you can lean on. And like Gone Girl says, her dog helps her. Anything to help you feel better. And of course, like I said, definitely go to the doctor. And if you don't get medication, if you don't, and medication is not for everybody, and not everybody likes medication. I don't like to take medicine. I know a lot of people don't like to take medicine, but sometimes you have to take medicine just to feel better. And unfortunately, it doesn't work overnight. It depends on what kind of medication you have. And I'm not going to talk about medication, but I'm just saying, depends on what kind of medication you're on, depends on how fast it gets into your system and you start feeling better. But just because you feel like crap and it takes a while to kick in, don't stop taking it, because eventually it will start to regulate your body and you will start to feel better. I'm just saying, I'm just trying to help you guys and bring awareness out there and let you guys know it's very important. Your mental health does matter. It does matter. That's what I'm saying, guys. I definitely wanted to bring awareness back to mental health, which we've been talking about a lot of stuff. So if anybody, like I said, if anybody has any topics, or I mean, just saying, hey, Becca, would you like to talk? Could you talk about this or this? I want to involve you guys. I could not do this without you guys. So you're a part of this as well. You're a part of my stream as well. I can't do this without y'all. Talking to myself would just be boring. I'm just saying. I could not do this without each and every one of you beautiful people in here. They're amazing people. You're strong people. I cannot do this without you guys. So if y'all have any topics or anything y'all would like for me to go over, I mean, y'all know I do a lot of reading and a lot of research. So if there, and I do it for a reason, guys. I really do it for a reason. I'm not doing it to make people fall asleep, because I've heard a lot of people say, well, you have a soothing voice. I have to rewatch the replay because you're just calming. You're just calming. And I'm like, well, thanks. I mean, but I do a lot of reading, and I don't know how you do slides and stuff like that. If I knew how to do slides, it might be a little bit faster. But I do a lot of reading because I'm you're good, Mr. Michigan. We love you too, brother. You have a good night. Tell Mrs. Michigan we said, hey, I cannot remember her name. I'm really bad on names, but tell her we said, hey. But like I'm saying, the one reason I cover so much information is I'm trying to get the most information out there, just like people do with true crime. Okay. But I mean, like, say, for example, I'm just saying, Rebel, for example. Okay. He's going to talk about Summer Wells tomorrow night. But there, I'm just saying, for an example, there's a lot of information out there on her. Okay. And there's been several people cover Summer Wells, and there's several different stories about Summer Wells. I'm just saying, camping gal. I'm really bad. Sorry, Mr. Michigan. Well, tell her that we said hello and hope she's doing well. She can come in here anytime. Good night, Demetrius. Good to see you, honey. Have a good one. Okay, sweetie. All right. But I cover a different topic every day. I cover a different topic. So I'm not just straight on one specific thing, which I love that I'm not down in the true crime community at all. I'm just saying, so I bring a lot of information at once because I'm covering one topic every single day, a different topic, if that makes sense. So I'm trying to get as much useful information in there as I possibly can during the one live that I have. And then I go the next stage to talk about something different. And then the next day talk about something different or whatever. See, there's so much information. I mean, there's a lot of information out there that I cover. Don't get me wrong. But I go searching for the best one to talk about that concerns what we talk about in our stream, which is mental health, well-being, support, awareness, positivity, encouragement, and motivation. So I go digging deep because there's a lot of information out there for each topic that we cover. But in order to find what we go over every day, I got to go really deep dig, and deep dig. Dig deep. I'll get it right here in a minute. So I was, I always try to get out as much possible information as possible to bring more awareness to whatever I'm talking about. So I know, like I said, I know I do a lot of reading, and that's not, I just want to be very supportive to whatever I'm talking about. Be very, I have a lot of awareness to whatever the topic is, and to let you guys know, whatever the topic is, to bring awareness to it, and hopefully it helps you guys. The more information, the better. But like I'm saying, I cover a different topic every day. So I'm not like, like the true crime community, they can talk about, a child. Well, let's just say Summer Wells, for example, because I did cover her vigil. So we'll say for Summer Wells, for example, they can cover her a lot of times because there's so much information out there. Granted, there's so much information out there that I talk about, but it's still, a lot of it's triggering, and I don't want it to be really triggering. A lot of it doesn't concern really what I'm trying to look for in regards to like awareness and motivation and encouraging and support, and all the stuff that we as a whole stream have started to look for, that I've started, but what I'm talking about. So like, I go digging deep, as the Redneck Connection says. I go digging. What's up, Redneck Connection? How are you doing, brother? But I go digging deep. So I cover a buttload of information in the short time that I'm in here. A buttload of information. And I don't mean to make people doze off and stuff. It's just I want to definitely get the information out there and bring awareness to whatever I'm talking about, and letting people know that they are not they are not alone in this world, that your life matters, that you matter, that you're important, you are loved, you are cared for. It doesn't matter, what exactly you're going through mental health wise. Just know that there are people that care for you. You matter. You are a survivor for what you've been through in your life, and just please get the help you need, because your life matters. You matter, and you're not alone in this world, guys. You're not alone. There is support out there. There is support out there for each and every one of you guys. Oh, I would love to. I would love to, Criminal Med. I would love to come paint with you. You might have to teach me, but I would love to. But I'm just saying, that's why, a lot of people say, and they don't really down, but they're just like, girl, you read a lot. And I'm like, I'm just trying to get a lot of awareness out there, guys, because I cover so many different topics every day. I'm going live more often, and I'm bringing more awareness and support out there. I just want to be the good in the world. That's not a bad thing. You know what I'm saying? I just want to be the good in the world. I want, to, if we can, and I know it's hard, but if we can just be a difference in somebody's life, be kind to somebody, be positive as much as you possibly can. I know, I'm far from perfect, and nobody's perfect, but like I say, you never know what somebody's going through. You never do. So always be kind to somebody, because you don't know. You have no idea. So kindness goes a long ways, guys. And never judge a book by its cover, because you don't know. Just because somebody doesn't dress like you, or doesn't act like you, or doesn't do this and this and this like you, doesn't mean that they're less of a person. They're still a person. They're still a person. It doesn't matter if they don't come from money, or if they're poor, or if they don't have specific clothes, or they don't look like you don't want them to, or they don't wear makeup every day, or whatever the case may be. They are still a person. They still have feelings, and their life matters too. I'm just saying, guys, it's very important to bring awareness and support for these topics, because a lot of people just throw them under the rug, so to speak. And it is very important. People's lives are very important. I just don't understand. Like Tattoo Rebel, he was going over, those precious babies' lives. And I'm not really talking about true crime, but I'm just saying it really affected me. He showed it to me last night and absolutely ripped my heart out. Like, why can't people just be good? Why can't people just be positive? Like, the negative is just absolutely draining people. Like, it's, be good. And that, I'm just saying a little rant for a minute. That dude better not claim insanity or mental health, because wherever he's at, I might just go up there and punch him myself. I'm just saying. Because that's not right. You don't unalive your children because they pissed you off, or they whatever his reason was. You don't unalive your children. Those children were innocent. They were beautiful babies, and they didn't deserve what their piece of shit daddy did to them. That's just me. That's just me, guys. That's just my opinion. I'm just saying. So, that's one reason I don't talk about true crime a lot, because I really dig deep into it, which a lot of people say I would be good for it, but mentally it really affects me, and I would be a basket case all the time. I would be crying all the time, because a lot of people say I'm an empath, which I think I am, but I'm more of the highly sensitive person empath. So I have more empathy symptoms, like stronger empathy symptoms than a regular empath, if that makes sense. So I feel for everything. I even feel for the guys that in the submarine last night that I pulled up on my screen. I've been watching that stuff all day. I just hope and pray that they get found safely. That's all we can do. That's all we can do, because good human beings still care. And I know that they're still out there, guys. We just have to weed through all the bad and the bullshit to find them, and let people know, hey, it's okay to not be okay. It's okay to be yourself. It's all right to ask for help. It's okay to get support. It's perfectly fine. It sucks that you had to suffer with mental health because of your past trauma or whatever you went through, but it's okay to not be okay. There is help out there and you can get it. You can get it, guys. It's important. Your life matters. You matter. Oh, I get very, very, I can't help it. I just feel for everybody. And I just want to help as many people as I can. Make a difference in somebody's life. Make a difference in somebody's life. That's all I want to do. I want to bring support, awareness, motivation, encouragement, which I know it's a lot, but I want to make all the good things. Take all the good things and try to make something better. Lift somebody's spirits. Lift somebody's spirits and lift them up. And if I make a difference, or if we as a whole make a difference in just one or two people's lives, that is a winner in my book, and that blesses my heart. That just make a difference in somebody's life and show that you care and show that you support them, because people that suffer with mental health, it sucks ass. I'm just being real with y'all. I have never lied to you guys. I've always been real with y'all. But living with a mental health or mental illness condition honestly just drains the hell out of you, and it sucks. And I myself am getting medical treatment, and it still sucks because you have your good and your bad days. Nobody's perfect. Well, that's good. I'm just saying, nobody's perfect. Rome wasn't built in a day, as the old saying goes. When you go to get your help, please go get your help. If you suffer with anything, depression, anxiety, anything like that, your life matters. You're very important. But, just please go get some help. Like I said, where I see it, Rebel, Lord have mercy. Hold on a minute. Rebel said banging sounds heard during Titan's search, according to internal U.S. government memo. Well, that's good. I guess that the people that are in the submarine are letting people know, hey, we're in here. Hey, I do the same thing. But I couldn't imagine. I would be claustrophobic. I couldn't imagine, guys. That's been kind of like on my heart all day, because I couldn't imagine what they're thinking. Oh my gosh, 13 at least. Okay. If y'all haven't followed it, which I'm sure that y'all have, but I'm just saying, okay, they lost contact after an hour and 45 minutes going down into the water in that little submarine that's the size of a minivan, guys, with 5 people. The Titanic is 13,000 feet below the sea level surface. 13,000 feet. They only have like 30-something hours of oxygen left. And they've already searched, I think, when I've looked at, because this is not really a true crime. It's more of an awareness, and it's more rescue. But to me, it's more of awareness. We're bringing awareness to them, to say good vibes to them and prayers, that they're found safely, But I've been watching that all day long. 2.4 miles below the surface. That's extremely deep, guys. It doesn't seem like a lot when you're driving, but when you're in water, that's a lot. And they're saying there's no, of course, there's no light at the bottom of the ocean. So I don't know how much light they have in those submarines, or if the lights already went out. But all they have, it's the size of a minivan, and in the front, it's clear. So what they're looking at is black. It happened off the coast of where the Titanic's at, Miss Ann, honey. Where the Titanic, hold on a minute. Hold on a minute. Let me see if I could pull it up. Give me just a minute. Let's see if there's an update on it, because I did cover it last night, so I'm just kind of curious. Give me just a second, guys. News. All right. This was... Crews searching for missing tidings submersive have heard banging sounds. According to reports, CNN reports bangs were heard every 30 minutes on Tuesday local time and 4 hours later. So that means that somebody's in there making all kinds of noise or something just to be heard. That means that somebody's alive. I mean, that's what I'm guessing. That's what I'm guessing. Somebody is making some kind of noise to be, heard. So that means that somebody is alive, and hopefully all of them are alive. But I'm just saying, hold on a minute. Is this it? Give me just a second. Let me see if this is it. They got a video of it? Well, if I can play. Where'd you find that at, Rebel? Play it for me. Or send it to me. Because I was going to play a video, but I don't see a video. Hold on a minute, guys. Because, like I said, I covered it last night. I'm not really for sure. That's what I'm kind of looking. That's what I'm looking at. Like the most recent. I see that. Let's see. Hold on, wait a minute. All right, hold on just a second, guys. Okay. You're welcome, Sharon. Well, hey, I bring awareness, so we're all about some awareness. And so if I can, hold on a minute. Okay, is this what you're talking about, Rebel? Because I think I found it, CNN.
On the massive search operation we are breaking news tonight on the massive search operation to find that submersible with 5 people on board that went missing Sunday on a trip to view the wreckage of the Titanic. There is a new development in the past hour. Crews searching for the sub reportedly heard today banging sounds at 30-minute. We are breaking news tonight on the massive search operation to find that submersible with 5 people on board that went missing. We are breaking news tonight on the...
Why does it keep on doing that? I'm losing my mind. Anyway, let's see.
We are breaking news tonight on the massive search operation.
Quit. That was not a 2-minute thing. I don't know how. Hold on, wait a minute. Let me see if I can. Here we go. All right. Hold on 1 minute. Okay. Let's see if this will play, because Rebel sent me this one. All right. Let's see if it'll play.
Late last year, OceanGate founder and CEO Stockton Rush showed a CBS team the inside of the Titan submersible used for the company's Titanic expeditions.
Take your shoes off, that's customary. Okay. Wow.
Inside, the sub has about as much room as a minivan.
How
this is
tiny.
not your grandfather's submersible.
And 5 grown adults.
We only have one button, that's it. It should be like an elevator. It shouldn't take a lot of skill. We run the whole thing with this game controller.
Come on!
We're joined by David Gallo. He is a senior advisor for strategic initiatives with RMS Titanic Inc., the company that owns the exclusive salvage rights to the Titanic wreck site. Thank you so much for talking with us.
My pleasure, Brooke.
Now, this search and rescue effort is a desperate race against the clock, of course, to find the submersible and its crew before those oxygen supplies run out. What are your main concerns right now?
Well, I've been in this business for about 4 decades, and this is as tense as I've ever seen the community or sensed the community. It is a race against time. You're fighting oxygen levels. They should have a day or 2 more left of oxygen. Also fighting the cold if the sub is still in the bottom, because the deep ocean is just above freezing cold. So hypothermia is an issue. I think one of the biggest things, where is it? Is it on the bottom? Is it floating? Is it midwater? And that's something that hasn't been determined yet. Hopefully, with all the help that's coming to bear, it will be found fairly quickly. But that's a dangerous thing to say, because I don't know if that means a day or 2 days or 3 weeks. And we'll have to wait and see and hope for the best.
A church in Mexico submerged for about 60 years.
Isn't that crazy? It's crazy, isn't it? Let's see. Let's see if there's an update. Hold on. Okay, hold on a minute, guys. I'm trying to find something else that has more info, if I can. Hold on a minute. Okay. All right. This is more information on it, Miss Ann, if you haven't heard, or if anybody hasn't heard. This is just a little bit more information on it. This was 25 minutes ago. What we know about the missing Titanic submersible. Hopefully this one will play. The other one did not want to play, so hopefully this one will play, guys.
It vanished while diving on the Titanic shipwreck. 5 people were on board. The U.S. and Canadian Coast Guards. The race is on to find a submersible. It vanished while diving on the Titanic shipwreck. 5 people were. The race is on to find a submersible.
I don't know why it keeps on doing that. I have no idea. Okay, I'll just read it to y'all because I don't know why it keeps on doing that. I have no idea. It says a submersible carrying 5 people to see the remains of the Titanic at the bottom of the North Atlantic Ocean is still missing despite a massive search operation. But banging sounds were reported heard in the area Tuesday as time runs out. Search teams heard the sounds in 30-minute intervals Tuesday, according to an internal government memo update on the search. Banging was still heard 4 hours later after additional sonar devices were deployed. A subsequent update sent Tuesday night suggested more sounds were heard, though it was not describing as banging. Still, it indicates continued hope of survivors, the update said. CNN has reached out to OceanGate, the U.S. Coast Guard, and Boston and Canada authorities for comment. Rolling Stone was first to report the news Tuesday night. The Titan submersible has been on its way to the famous wreckage off the coast of St. John's, Newfoundland in Canada when it lost contact with its support ship, leaving the people on board with only enough oxygen for a few days. Here is what we know so far. How did they go missing? The submersible was part of an 8-day journey conducted by OceanGate Expedition, priced at $250,000 per person. The trip is based out of Newfoundland, with participants first traveling 400 nautical miles to the wreck site, which is about 900 miles, 1,450 kilometers off the coast of Cape Cod, Massachusetts. The submersible began its 2-hour descent to the wreck on Sunday morning, June the 18th. It lost contact with the Polar Prince, the support ship that transported the vessel to the site. 1 hour and 45 minutes into the descent, officials said. Search operations began later that day. It's still not clear what happened to the submersible, why it lost contact, and how close it is, or how close to the Titanic it was when it went missing. Who is on board? While authorities have not released the name of the 5 missing people, British businessman Hamish Harding, French driver Paul Henry, I cannot pronounce his last name, Pakistan billionaire Shahzada Dawood, and his son have all been confirmed to be on board. The fifth person is the OceanGate CEO and founder Stockton Rush, according to a source with knowledge of the mission plan. OceanGate did not respond to CNN's request for comment. Harding is based in the United States, Arab something, and is the chairman of aircraft brokerage Action Aviation. The company said on social media that Harding was on board the submersible. Harding himself had posted online on Saturday saying he was proud to announce his participation in the dive to the Titanic. Let's see. Harding is a avid adventurer, having traveled to space on board the Blue Origin flight last year and had to Challenger deep in the Pacific Ocean, believed to be in the deepest point in the world. Had he posted on Saturday night, the Nargilolet was scheduled to be on the submersible with him. Nargilolet's family confirmed to CNN affiliate that he was aboard the vessel. The diver has decades of experience exploring the Titanic. He serves as the director of underwater research at RMS Titanic Inc. The company has an exclusive rights to salvage artifacts from the ship. According to this biography on the company's website, Nargilolet completed 35 dives to the Titanic wreck and supervised the recovery of 5,000 artifacts. The Pakistani father and son were also confirmed to be on board in a statement by their family. The Daywoods are a prominent Pakistani business family that runs some of the largest corporations in the country, with a portfolio spanning energy, petrochemicals, fertilizers, and food and architecture. That's the sub right there, guys. That's the Titanic sub that is missing in the ocean right now. It says, how much time do they have? The submersible is designed to carry 96 hours of oxygen, which is 4 days. For 5 people on board. By 1 p.m. Eastern Tuesday, the U.S. Coast Guard said it was likely had 40 hours left. Okay, so that was 1 p.m. today. It's 12 a.m., so they got a little over a day left, like a day and a half. That gives authorities until around Thursday to locate and retrieve the vessel. But there are a number of challenges, including the remote location, local weather conditions, the state of the submersible, and the extraordinary depth of the ocean in the area they went missing. The deepest ever underwater rescue was that of Roger Chapman and Roger Mallison, who were rescued from the PC-3 submersible at the depths of 1,575 feet in 1973. They were trapped for 76 hours before finally being hauled to the surface. The Titanic wreckage is much deeper, sitting at nearly 13,000 feet below sea level. And it's not clear how deep the submersible is. Some experts have pointed out it might be near the surface, since submersibles typically are able to shed weight for additional buoyancy. But even if they reach the surface, the door is bolted from the inside, meaning there's still risk of running out of oxygen unless they are located and freed by rescuers. What is a submersible and what is it like inside? A submersible is different from a submarine in a few key ways. It has limited power reserves, so it needs a support ship on the surface to launch and recover it. It can't stay underwater for as long. The Titan typically spends 10 to 11 hours during each dive to the Titanic wreck, compared to the submarines that can stay underwater for months. The Titan is made of carbon fiber and titanium, weighing about 23,000 pounds, with safety features to monitor the structural integrity of the vessel, according to OceanGate. It is also small and sparse on the inside, with about as much space as a minivan, according to CBS, who took the trip on the Titan down the Titanic wreck last year. There's only one toilet and no seats. Passengers sit cross-legged on the floor. There are no windows except the porthole through which passengers view the Titanic. I guess that's the hull of the Titanic. That's how you see. But just imagine, guys, just imagine if they don't have no light. They're sitting in the darkness. I would freak out. Like, there's no way. And being in that confined space, that's the only window they have. And they're in an ocean. I can't imagine. Prayers for them. Hopefully they're found safely. That's what's scary about it, because I can imagine. I cannot imagine. I've never been in the ocean. I've never been to the beach. But I'm just saying, I could just from the videos I've watched, oh my gosh, that water is extreme. Like, that water's crazy. That water's crazy. And that's what I'm saying. If okay, after so many days, I mean, like, does the submersive still have power? Do they have electricity? It's probably already ran out. That it says it has emergency air oxygen supply, but what about power? Is there lights in it? Are they sitting in the darkness? I mean, I don't know how long the lights is, but we can see. It says a file photo shows the Titanic shipwreck through the porthole of the Ocean Gate submersive from Ocean Gate's expedition Twitter file. With no GPS underwater, the submersive is only guided by text messages from the surface ship. On Probe's trip, communications broke down during the dive, and the submersive was lost for over 2 hours, he said. The pilot steers a sub using a video game controller, but if that fails, a hardwire system can control the propellers, according to Aaron Newman, who took the dive in the Titanic in 2021 and is now an Ocean Gate investor. Thrusters are powered by an external electrical system, while an internal system powers communications and a heater, he said. It doesn't say, and it's not the size of a minivan. That's really not big for 5 grown men. What search operations are underway? How might it be rescued? Multiple agencies from both the U.S. and Canada are involved in the search. Look both on the surface and underwater. More than 10,000 square miles have been searched as of Tuesday. Boats, aircraft, and radar equipment are scanning above water in case the submersive has surfaced. Sonar buoys and sonar equipment on ships are also being used to detect sounds below the water. The U.S. Coast Guard, U.S. Navy, U.S. Air Force, Canadian Coast Guard, and Canadian military are all coordinated the search and potential rescue operations. France has also sent a research ship equipped with underwater robot to join the search. And that's one of the ships, I guess, is helping. Hamish Harding posted a social media image of the Polar Prince, the vessel used to transport the submersive to the site of the Titanic wreckage, which is that. From Hamish Harding Facebook, deep sea mapping company Magellan, mostly known for its one-of-a-kind deep-sea imagery of the Titanic, is also working to get its equipment to the site. But finding the submersive is just the first step. Rescuing it could be a whole other challenge, depending where and at what depth the submersive is found. There could be limited options for the rescue vessels. For instance, the U.S. Navy nuclear-powered submarines usually operate at 800 feet or less, meaning they can't dive down to the ocean floor, where water pressure on the submarine hull can make it implode. During 1973, rescue authorities used the other submersibles, and a remotely operated Navy-developed rescue vessel to attach lines to the PC-3, which were then used to pull it back to the surface. It's not clear whether these methods could work for the Titan, given the uncertainty around its location. Have there been safety concerns before? The incident has prompted discussion around the safety of the deep-sea tourism, with some pointing out that Ocean Gate has come under criticism before. 2 former Ocean Gate employees separately brought up similar safety concerns about the thickness of the Titan's hull when they were employed by the company years ago. A statement from the research lab also appears to show conflicting information about the engineering and testing that went into the development of the vessel. Ocean's Gate legal representative boasted the Titan's unparalleled safety features in 2021 court filing, saying it had been built with the University of Washington's Applied physics laboratory, but the university said the lab had never dealt with the design, engineering, or testing of the Titan. Industry leaders also expressed concerns 5 years ago about the company's experimental approach to the Titan submersible and its trip to the Titanic, the New York Times reported Tuesday. The Manned Underwater Vehicles Committee of the Marine Technology Society said it penned a letter to the Rush, the missing CEO in 2018. The group warned of potential negative outcomes from minor to catastrophic that would have serious consequences from everyone in the industry, said the letter obtained by the Times. OceanGate has not responded to a request for comment on the letter or on the two former employees' claims. Yeah. I'm trying to see if there's anything else, guys. That's crazy. Is that not crazy? Exactly. Why? I mean, if they're spending that kind of money, and that is a lot of money, why haven't they put it to use? You know? Okay, if there's 5 people and they're paying $250,000 per head, you got over $1 million sitting in that sub right now. Oh, well over $1 million. They say that the submersive is worth $1 million. Why can't they take, like, I'm just saying, I'm kind of the same way. You know, why ain't there more safety measures put in place? See, I thought, and there's a picture. And like I said, I've never been in the ocean. I don't know nothing about nothing. I have no idea. I don't know. I just know that this is not very good. 13,000 feet below sea level. And some people are saying they might got hung up on the Titanic. And I have a theory. I mean, it's not really a theory, but it's kind of deja vu if you think about it. I mean, that's just my opinion. Okay, they go to see the Titanic. The Titanic's in the bottom of the ocean. And now they can't be found. I'm hoping they're found. I'm just saying. But it just seems like deja vu in a way. Because it happened with the Titanic. And then now they're trying their damnedest to find these missing 5 people. And the submersive that's only got a couple of days of oxygen left, or like a day and a half. Like, it's just, you know, I just always think out of the box because I'm just like that. I'm just saying that's a lot of freaking money, guys. We can only hope and pray that they get found safely. I'm hoping when they do get found, we can only hope when they do get found that they're alive. I mean, I know it took a long time. I think the Titanic got found in, what was it, 1985, 1986, something like that. That was only 30-something years ago. And Titanic sunk in 1912, I think, or 1812 or something like that. Okay, this is a picture of that little idiot, that sub. It's not very big, guys. It's really not. It looks huge on this picture that I'm showing you guys, but it's really not big at all. For 5 grown adults. Look. It's not big at all. It's really not. Yeah, 1912. That's what I thought. That's what I thought, honey. Thank you, Steffi. That's what I thought it was, 1912. But yeah, that's it. Right there. That's it. It's not very big at all. I mean, that gentleman's sitting on the top. I mean, you see how big it is. It's not very big at all to sit 5 people. It's tiny. Like, it's little itty bitty. Okay, so they go in through it this way, I guess, up top. Because it looks like this picture, they go through it right here up top. I thought they went through it right here. But I guess they go through it up top. And it says Cyclops 1. I mean, it's not big at all. How in the world can you get a toilet in there and sit 5 people in there? And they have to sit, you know, like back to feet, back to feet. You know what I mean? Like this. So their feet are touching the other wall and their back's this way. Like it's too small. It's too small, guys. I can't do it. I can't do it. Okay. But yeah, that's it. And Rebel sent me a video. So hold on a minute, guys. But yeah, that's that little itty bitty thing. It's tiny. Like it's little itty bitty. Under 13,000 feet of.
Open up your Facebook.
I am.
I sent you a video of the inside of the very sub.
Okay, he's sending me a video of the inside of that little itty bitty sub. And little itty bitty. Teeny tiny. Little itty bitty. Okay, give me just a second, guys. Yeah, well, and the little window, I guess they climb into, but that window right there, they can look out of. That's it. Oh man, let me pull this up. What Rebel sent me. Well, better hurry. I know it's crazy. I would. And then they have one toilet. Where in the world is the toilet at? That thing is tiny. It says there is. I don't know. Don't ask me. I don't know. Well, I don't know. Hold on a minute, guys. I'm trying to get it pulled up. Hold on a second. Rebel says hi, everybody.
What's up, guys?
It's
Probably, you know. Put your thing on a minute. Tell me to go put your camera thing on.
Hold on, guys. I'm here.
All right, let me see it.
Rebel's trying to pull it up for me. Oh, my goodness gracious. My, close that out. Okay.
Yeah.
Criminal man. Hey, everybody's saying, hey, Rebel.
What's up, people?
You know, I'm not the tech savvy one, guys. He always has to help me. Exit out that one, babe.
That's your channel.
Well, it's not that, though.
Okay. Oh, I'm a bunch of computer.
I know my computer's a piece of junk.
Guys, if you can hear me, I'm getting ready to put it up. Now, this is the actual submarine or submersible. And there is no bathroom in it. I don't know what she's talking about a bathroom.
Well, I'm just reading what it said. Don't ask me.
I didn't see no bathroom.
It said a toilet.
What? Probably like one that's in the hospital.
Well, I'm just saying it just said toilet. I didn't say, that's all I said. It said toilet.
All right, this is the submarine. Tell me, put a 1 in chat if you can hear it.
It's got one button, and that's it. Yeah, so we run the sub with
Look
this
how little it
game
is, guys.
controller. It's and
it's run by that controller.
But it's basically a Sony PlayStation style controller. If you want to go forward, you press forward. If you want to go back, you press back. You want to turn to the left, it's like that. You want to turn to the right, you turn to the right.
They probably do, just like the space station.
Ain't that crazy, guys? That's crazy, isn't it? And then, oh, sorry, guys. And then, hold on a minute. Like, okay, so I put up some information, and I'm kind of like one of those people that go digging. I really do. For information. Okay. So do they have, okay, so they've been under the ocean since they've been on the ocean since Sunday, correct? All right. Well, do they have any food and water in that little teeny tiny submarine? What? Hold on. He's yelling at me. I'll be right back. He's yelling at me. Hold on a minute, guys. Probably wants to show me something. I'll be right back, guys. Okay, guys, I'm back. Okay, so I pulled up some information. Well, I mean, today I'm not going to show it to you guys, but okay, so in that little itty bitty submarine, there is I don't know if they have I trust me, I pulled up so much information on that today. It's just kind of interesting. Thank you, Rift. If you're watching this, you started something. I'm driving myself crazy keeping up with if they're found and stuff like that. I'm just playing, Rift. But thanks for bringing it to our attention, because I didn't know anything about it. I don't know if you're in here or not, but you might watch the replay. So thanks, Rift. But you can survive up to a week without food. It depends on how old you are, and if you have health conditions, depends on how much you absolutely cannot survive without water for at the most. Hold on, I don't want to tell you exactly wrong, but I know for food you can go up food wise, you can go without a week for up to a week without food, up to a week, and still survive without food up to a week. I mean, you're gonna be weak because you don't have no protein and stuff like that to keep your energy levels up. You know what I mean? Hey, Digger Duck, good to see you, love. Hope you're doing well, sweetheart. Okay, so I typed in how long can you survive without water? Okay. And this says how long you can live without water. It's a person may only survive a few days without water, but many factors affect how much water they need, such as their activities levels and environment. For this reason, it is not possible to tell precisely how long a person can live without water. Dehydration happens quickly, causing extreme thirst, fatigue, and ultimately organ failure and death. A person may go from feeling thirsty and slightly sluggish on the first day with no water to having organ failure by the third. Guys, if they don't have no water, that's not good. I'm just saying, I'm not trying to do a trigger warning, but trigger warning. If they do not have any water in that submersive, and they've been in there since Sunday, this is Tuesday, this is the third day, that's not good. I mean, I'm just saying that, they might be hearing banging noises. So that's a sign of hope, but I'm still, they're probably weak as kittens. I mean, I'm just being real with y'all. They're probably weak as kittens if they don't have no water on board. I don't know because it doesn't say nothing about that. But it's not like a regular submarine where it has a little kitchenette and all that stuff. It's just a submersive. It only goes down for so many hours and then comes back up. You know what I'm saying? And it's tiny in the humongous ocean. It's little itty bitty. It's only 21 feet long, guys. It's not very big in that humongous ocean. Like I'm just trying to think. I'm not trying to be the worst case scenario, but I'm just like, do they have water? Do they have food? I mean, I know they might be in the darkness, but you could still feel around for water and food if they're, hopefully they're not in pitch black dark, because that would be really bad. Like if they don't have mental health issues, this could be extremely traumatizing for them. You don't have to go through violence or anything like that to suffer with PTSD. I'm just saying that's just my opinion. This could be, you could go through PTSD and have anything traumatizing happen to you and have PTSD. So I'm just saying this could be extremely, extremely traumatizing for them if they don't have water, especially water. Like I said, you can survive. Let me see how you. I don't want to tell you wrong about the food. I'm just saying water is very important. You can you can dehydrate like quick. And I've noticed, I looked at the pictures, and a lot of the people, I don't know their ages, but they look older. You know what I mean? Like they, that one, his son, I think he's like 19. Now he's young, but the other ones look like they're older. So I don't know if they have health problems, but they asked them to go with an empty stomach, basically. So if they haven't had enough food, they're hungry. They're hungry because they said basically to go to have a light stomach. To have a light stomach. So what's to say they didn't eat anything? Like maybe they just ate something real light and drank something real light just to go, and was thinking they would be able to come back and then eat something real big because they did it. They have their name on the thing. It's a big whoop-de-doo-dah. They're having a party so they can eat. Well, I've come across, and it said that they requested them to not go in with their shoes. So they don't have no shoes on. I don't know if they're on the sub or not, but they don't have no shoes on. And they requested them to go with a light stomach. That's just my opinion. And like I said, the information I pulled up, because I've been watching this all day. The information I pulled up, I was like, what? But see, I think they should have stuff like that in place just in case something like this does happen. They should have extra oxygen supplies. I mean, that's if you're spending $250,000 a ticket to go see the Titanic, then they need to have every security measure in place possible, because that's a lot of feet below the surface. That's 13,000 feet below sea level. 13,000 feet, guys. That's almost 3 miles of ocean water. 3 miles. They need to make sure, they need to, well, one, make it a little bit bigger. Geez. Two, they need to, if they don't have it, they need to make sure that they have an emergency supply of water and emergency supply of food. Now, I read, I don't know where the post is. I wish I could share it with you guys. But I read they said that they had an like an emergency first aid kit for emergencies, but I have no idea what's in it. I don't know if it's got emergency food in it, it's got emergency water in it, or if it's just got Band-Aids and stuff like that. I have no idea. Let's see. How long you can survive without food is Let me see. Well, it's not showing up on this for some crazy reason. It's pulling up all kinds of. Let's see. Okay, how long can you survive without food? With no food and no water, the maximum time the body can survive is thought to be about 1 week. That's food and water. The human body can survive weeks without food, but most people can only survive 2 to 4 days without water. It says, however, some factors such as how much water an individual body needs and how it uses water can affect this. Factors that may change how much water a person needs include age and like health, like if they're like health benefits. So you can get dehydrated a lot easier than starvation, basically. So I'm just saying, I'm just trying to, I'm hoping that they're found safe. But we all know that if they're found, that they're going to be put in the hospital, definitely, for self-care and fluids and stuff like that, if they did not get any water or food in there. I'm just trying to think of like the outside the bubble type stuff. Nobody's really said nothing about food or water because they're more worried about the research, which not the research, the search and find, which that's all good and gravy. But I'm just kind of thinking of the broader picture. Okay, they're in the ocean, deep into the ocean, and it's dark. Okay, and that little itty bitty sub with 5 people in it sitting back to feet, like that. I'm just saying, is there any food or water in there? If there is food and water, there might be a chance that might help them. But like what we went over, if they find them, what the thing about it is, wherever they're at could be a pain in the rear end for them to pull them up. So they could be found all day long. I mean, it's still going to be a needle in a haystack to find because it's an ocean. But in the deepness of the water and how the miles, if they're that low, the miles. Okay. But like how, if they're at the bottom of, say for example, they're at the bottom of the ocean, which I hope and pray not, and they're stuck on something, which whether it's the Titanic wreckage or whatever the case may be. Okay. And it can't float back up because that's what it was supposed to do. How are they going to get them back up? How are they going to get them back up if they're 13,000 miles below sea level? I'm just saying. Like I said, there's all kinds of stuff. There's sonars and cameras and all kinds of stuff because like me and Rebel was talking about earlier. Okay, if they're using cameras and videos to drop it down in the ocean without nobody attached to it, just drop it down in the ocean and look at the Titanic at the bottom of the ocean. Why can't they take that camera and that video, that little thing that moves stuff out of the way with the claws and stuff? Why can't they do that to see if the sub is down there? And if the sub is down there, then you go to the next step of figuring out how the hell to get it back up with a little nudge or something. I mean, I don't know how you do it, but if you're 13,000 feet in the ocean, at the bottom of the ocean, how are they going to get them pushed back up? That's my theory on it. Like Rebel said, they can be found. That's not an issue. The issue is once they find them, just like I went over with you guys, once they find the sub, did their oxygen run out? Do they still have time? Because once they find them, they know where to pinpoint, but then they have to get something to get them up and push them up out of the ocean from where they're at. You know what I mean? Like, it's the ocean. It's not like it's, you know what I mean? It's in the water. It's in deep ass water. There's got to be something to be able to go underneath something big and kind of give it a little shift, you know, put floaties underneath it or something. So how in the world are they going to do that? That's the question. If you only got a day and a half left of oxygen, their clock is massively ticking. And I just hope and pray that they're found soon. And they're, you know, like I said, I know they're more than likely probably going to be hospitalized for a while, but I mean, for a little bit, you know, to get their strength back up and stuff. But I'm just hoping that they're alive. We can only hope for the best. But I mean, I'm just trying to look at the broader picture, you know. It's kind of scary. It's very scary. It's very scary that you think about it. It's very scary. So all we can do is really just, you know, lift them in our prayers and just give them good vibes, and hopefully that they're found safe and in that time frame, because unfortunately time don't stand still. It keeps on ticking, unfortunately. So, you know, that's what sucks about it. They got, when I read about it, it was less, okay, let's see, I think it was before 2:00 today, Eastern, our time. So they have, it's almost 2:00 now. So they have, let's see, maybe a day and a half left of oxygen. That's it. And they had 4 days. Yeah, they had 4 days total. 4 days total of emergency oxygen. And they're still, so they was thinking sometime Thursday. This is Wednesday morning. Well, my time is Wednesday morning at almost 2. Well, 1:30. Yeah, 1:30, which I'm getting ready to jump off here. But yeah, I'm just saying, you know, just bring awareness to them too. So lift them up, and them and their families up in your prayers and thoughts. And hopefully they're found safe, because like I said, unfortunately, time does not sit still. It keeps on going. So they're kind of like a race against the clock, so to speak, concerning the oxygen. If they put more tanks on them or something like that, there ain't nothing that you can do right now until it's found and it's pulled up out of the ocean. That's what sucks. Yes, exactly. It was not for research. It was only fun. It was just, you know, for them to go down there and see it. And now, you know, their lives are in massive danger right now. It's scary. But yes, but thank you guys so much for being in here. I'm getting ready to jump off here because the kiddos got school in the morning and I got to get up at 6:30, and that's here in about 5 hours. So they can't get sonar on it if the main Titanic is blocking them. If they're below it, the depth they are, it requires a major depth suits and knowledge. That's what I'm saying. Like maybe just get a lot, like a glimpse or something, because they can see the Titanic if they drop it down. You know, if you look at the scientists, you know, we've seen the pictures of the Titanic, what it looks like. So they bound to have something that dropped down in there. So because we can see the Titanic, what it looks like now. So couldn't they just drop whatever that is and just get a glimpse and see, maybe if they see the tail end of it or something, you know? And some of those things have like claws where you can actually move junk, you know what I'm saying? So maybe if you could get, I don't know how big those things are, but maybe if they seen it, maybe they could give it a little nudge or something. I mean, I don't know. I'm just thinking out of the box, just something that might be able to help, you know? I don't know. Just bring a little bit of awareness might be able to help. I'm not really for sure. I'm not a scientist. I don't know nothing about. It's just a scary thought. But I just pray for the families and pray for them, and hopefully that they're found safe. Hopefully that they're found safe and they have enough time to get back up and get the care that they need, because you know that they're going to be needing a little bit of hospital care if they're found in time, which I hope that they are, you know. But y'all have a wonderful night. Thank you guys so much for coming. Tomorrow night is we're going to do every Wednesday, just to mix it up a little bit. Every Wednesday is our open panel positivity night. Every Wednesday. I just started that, just kind of mix it up a little bit to kind of separate and then give people a chance, if they want any topics, to give people a chance to tell me so I can write it down, so I can start my research and stuff like that. So every Wednesday night is open panel positivity night. So we kind of have to stick to, the positivity, the good vibes, which we do anyway. I'm just saying the positivity, good vibes. I know that's what sucks. Positivity, good vibes, no negative, just all laughs and smiles and all the good stuff like we normally do. And then of course Friday is the open panel karaoke and music and bright night. That's every Friday. And then we're going to do every Wednesday is an open panel, positivity, motivation, encouragement, laughs, smiles, lifting people up, supporting one another. That's what we're going to do tomorrow night. So I hope to see you guys there. Y'all have a wonderful night. Thank you guys so much for coming in here. It means so much to me. Much love to you all. And hopefully the information that I provided for you guys tonight when it regards to bipolar, understanding bipolar disorder, will help you guys and help your friends or family members. And remember, your life's important. You matter. And please get help and ask somebody to go with you if you don't feel comfortable going by yourself, because you matter. Your life's important. You are loved and you are supported. So y'all have a wonderful night. Remember to lift each other up, be there for one another, and support one another. And I will see you guys tomorrow night. It's between 10:30 p.m. and 10:45 p.m., give or take, in between that time frame. So I love y'all. Y'all have a wonderful night, and thank you guys so much for being in here. Virtual hugs. Love y'all.